Hello, my name is João Quelhas from Portugal, and I'm presenting treatment of common peroneal nerve palsy with unknown etiology, a clinical case. The common peroneal nerve is the most injured nerve in the lower extremity. It clinically reveals with lack of strength in the anterior muscular compartment of the leg. There are many causes of foot drop, and compression of the common peroneal nerve is the most frequent one. Yet, in some cases, the origin of the problem may remain unknown. In peripheral nervous system causes of CPN palsy, the treatment divides in non-surgical treatment, such as activity modification, padding, night splints, or rehabilitation. In acute injuries, the surgical treatment can be exploration and decompression, primary repair, or nerve grafting. In non-acute injuries, the surgical treatment can be excision of a compressive mass, decompression, nerve transfers, or tendon transfers. When conservative measures and nerve surgeries have failed, secondary procedures are required. The primary aims of tendon transfers in flat foot are to restore active dorsiflexion of the foot and correct the inversion deformity when the peroneal are also paralyzed. The transfer of the posterior tibial tendon is the typical tendon transfer used in these cases. I'm doing a description of a clinical case, imaging findings, treatment, and the evolution of a case of common peroneal nerve palsy. This is a case of a 31-year-old woman with no relevant medical history and no history of trauma. She presented with a drop foot that developed progressively over a course of 2 years. The electromyography showed severe lesion of the common peroneal nerve at the knee level, and the lumbar spine MRI did not show any nerve compression. Neurologist consultation excluded the presence of a neuromuscular disease. During follow-up, the patient walked with an ankle-foot orthosis. Because of the prolonged time of nerve damage, the patient was proposed to a tendon transfer surgery. It was performed a tendon transfer of the tibialis posterior to the tibialis anterior, extensor hallucis, extensor digitorum, and peroneal tertius tendons. In the first image, we see the tibialis posterior harvest, then a split of the tibialis posterior in 2 tendon slips, the tendon shift through a circumtibial root, then the suture to the tibialis anterior and extensor hallucis longus tendons, then the suture to the extensor digitorum and peroneal tertius tendons, and in the final image, the final result with a normal foot position. The treatment was followed by a 1-month cast immobilization, physical therapy to regain walking ability, and at 6 months, she had a normal gait and was satisfied with the outcome. Tendon transfers may be used to restore function to the foot and ankle in irreversible palsy. Preoperative assessment evaluation of the involved muscles plays a major role in determining the choice of procedure. Tibialis posterior is the ideal choice for the transfer when the anterior and lateral compartment are involved, as in the described case. Isolated deep peroneal nerve involvement should be treated with rerouting of the peroneus longus. The 2 commonly followed routes are the interosseous route and circumtibial route, yet the literature shows that the difference in functional outcome between the 2 routes is negligible. Fixation of tendon can be done to bone, periosseum, or tendons on the dorsum of the foot, most of them with good functional results. We used a modification with the inclusion of the tibialis anterior of a described technique described by Srinivasan, with a split of tibialis posterior tendon and suture to extensor hallucis longus, extensor digitorum longus, and peroneus tertius tendons through a circumtibial route. So, tendon transfers with tendon-to-tendon fixations are easy to perform and can give excellent results in achieving good balance of the foot and ankle. Thank you.